And the live stream is preparing. Give it 1 second. So as you can see in the top left, it says live.
Mm-hmm.
And you're live.
Great.
Good afternoon. Hi, everybody. Welcome to this Facebook Live event for Home Instead. My name is Kathleen. We're excited to be here today, myself and Kristen from Senior Care Network. And I got to admit, this is our first Facebook Live event, so it feels very important. And we're so pleased that Home Instead asked us to be here because today is an important day and this is an important topic to talk about. So we're going to be sharing with you about elder abuse because today is Elder Abuse Awareness Day. We're going to talk about awareness, what is elder abuse, how to prevent elder abuse. And so we're glad that you're joining us for this special event on Facebook. And so I wanted to share a little bit about myself. My name is Kathleen Coatta, and I am a supervisor over at Senior Care Network. I'm a social worker by training, and I supervise our resource center. And the resource center is sort of a go-to place for the San Gabriel Valley to ask about questions related to senior care, various things that seniors need and older adults are looking for in the community. And we also operate out of Senior Care Network 2 Medi-Cal waiver programs. And those are programs for people who are on Medi-Cal who want to stay living in the community. That would mean they want to stay living at home or in an assisted living and avoid nursing home placement. And our resource center staff helps people to figure out what programs are right for them and if one of those Medi-Cal waiver programs might work. So we're going to provide some phone numbers for the resource center toward the end, but I wanted to give you a little bit of details about our program. So because the numbers are coming later, I did just want to say, because of the sensitive nature of this topic, that if you do have an immediate need for support related to abuse, that you should please not hesitate to call your local law enforcement, police, or sheriff. And I will provide some additional resources as the presentation goes on, but please don't hesitate to contact those local supports if you need them right now. So I'm going to turn it over to Kristen so she can introduce herself.
Make sure I'm not on mute. I'm not. Hi, I'm also very pleased to be here today. My name is Kristen Tachiki, and I am a clinical social work specialist at Huntington Hospital Senior Care Network. Kathleen is my clinical supervisor. Again, we're both pleased to be here. Through my work at Senior Care Network, I've been blessed with the ability to put on multiple caregiver support groups that we're going to talk about later, do some wonderful community outreach, similar to what we're doing here today, and also just recently take over the Telenoon Hour, which is a free service to the community. Anybody can call in and listen to topics from medical doctors, physicians, specialists on various topics that range from hair loss to podiatry care. So, and we would be more than happy to share that information with you through the Resource Center. And thanks for having us. Thank you, Home Instead.
So we're going to go over a little bit about elder abuse awareness. I'm going to give kind of some background facts and information. And if you do have questions, feel free to put those in the chat, and we're going to address questions at the end of the presentation. So I'm going to start with the basics of what is elder abuse and neglect. So this is a hefty topic, but I'm hoping that I can break it down and that we can kind of go over what things you should be on the lookout for, you know, experiences in your own lives or things you should watch out for older adults in your community, in your family that you care about. So there are several different types of abuse and neglect we're going to go over, and I'm going to start with physical abuse. So it's very common for people to think of abuse as something physical, and that would be caused by bodily harm. So hitting, pushing, or slapping This could also include restraining of an older adult against his or her will, such as locking them in a room or tying them to furniture. So this is definitely something we want to be on the lookout for, and we'll talk a little bit about signs to look for in a bit. Now, the other form of abuse I want to share with you is emotional abuse, sometimes also called psychological abuse. And this could include the caregiver saying hurtful words, yelling, threatening, repeatedly ignoring the older adult, or keeping that person from seeing their close friends and relatives. So that can be a form of an emotional abuse because the person feels isolated. And I have a couple of case examples to share, which I hope will kind of help you to better understand how this kind of abuse can show up in our community. So the first example is of a woman named Vivian. And Vivian is in her late 80s. And she's been living with her middle-aged son, Stephen, for a number of years. Now, Vivian is on Social Security and does not have any other income. She has some minor disabilities, but otherwise she's fairly independent and she's self-sufficient. And she actually originally asked her son to move in with her because she recognized that he had a substance abuse problem. And she thought that he could recover, with her help in her home. So she was a caring mom. She was kind of looking to take him under her wing. But once he moved into the house, he continued to use drugs. And that led to a pattern of psychological abuse. So he would talk down to Vivian. He would take and misuse her possessions. He would isolate her. Friends would call and he wouldn't let her talk to them on the phone, for instance. He wasn't helping with any housework, and he didn't contribute to the costs of the household either. So during this process, Vivian's quality of life really suffered, and she was depressed and fearful. In this case, Vivian eventually got some help, and we're going to talk a little bit later about how someone in such a situation would go about getting help. I want to go over just a few other forms of abuse to kind of shed light on some of these things that you might have seen or you maybe have experienced, unfortunately. Another one is called abandonment, and that is when an older adult who needs help is left alone. Now, many older adults, we know you're active, you're independent, you live on your own, and you've always lived on your own, and that's perfectly fine. That's wonderful. But some people actually need some help every week, every day, and if the family members who are helping them just up and leave without making a plan for their care, then we consider that abandonment. Sexual abuse is also a form of abuse, and that would involve the caregiver or another person forcing the older adult to watch or be part of a sexual act. And now I'd like to spend some time talking about financial abuse because this is a big topic. It is something that we see a lot in the news, and it is a prevalent form of elder abuse. So financial abuse happens, when money or belongings are stolen from the older adult. So this can happen when checks are forged or someone takes someone else's retirement or Social Security benefits, using another person's credit cards. And it also could include changing the names on important documents like wills, bank accounts, without that person's permission. Now, in a lot of cases, family members kind of join together to help an older adult, and maybe daughters or sons will be on the bank accounts because they help to manage the finances, and that's a huge support. So that is not a problem. But if someone is joining the bank account unbeknownst to the older adult, taking money out that they're using for their personal needs, then this is when financial abuse can happen. And a big issue that we're seeing lately with financial abuse are scams that are targeting older adults. Now, Kristen and I, we work, like we were saying, in a resource center team. So we have some colleagues, and we did a presentation for them yesterday to kind of practice for this. And they were like, well, what about this scam? And what about that scam? And it's true. Unfortunately, there are dozens of different types of scams where older adults are targeted. And we're trying to figure out how to get at these scammers when they're calling from overseas or another state and they seem completely untraceable. So it's super important to educate the community about these scams, to educate others. And so I'm going to go over just 3 today, but I totally recognize that there are a number of scams that many people are experiencing. And even if you're not duped by it, you might still be getting the phone calls. And, a lot of us get those phone calls every day. So the first one I wanted to mention is healthcare fraud. And this is really like a growing industry of scams because scammers can use a Medicare number to basically falsely bill for services. So they might find out that a senior is diabetic and then offer that senior their diabetic supplies, testing strips and other things, bill Medicare for it, get paid, but then never send the testing strips to the senior. So it's really important that you don't give out your Medicare number to someone that you don't trust. And the challenge here is that sometimes they might bill something unbeknownst to you. And only several months later, when your doctor says, oh, I want to start you on some test strips, and then you didn't have them, and Medicare is saying, I can't pay out on that. You already got this service, when really you didn't get it and you were frauded. So it's important to keep your Medicare number private and only share it with doctors that you know and other providers you know. The second scam I wanted to talk about was sweepstakes or lottery scams. And that is when someone is trying to promise you a big reward, but first you have to make some payment up front. And this was even happened to a former FBI director. He and his wife were scammed. They said, pay us $50,000 and then you'll get 72 million and a new Mercedes-Benz. Of course, they were luckily not duped. But it's really important to be on the lookout for anything that requires you to make an upfront payment, because this is the way they, take your money and then never give the prize promised. And thirdly is what's called romance scams. And these are scams where seniors, especially widows or widowers or recent divorcees, are they're very vulnerable. And the scammer, spends a lot of time building their trust and getting to know them by phone and talking to them, and then says, well, I need a little bit of money for this. And because that relationship has been formed, many seniors give over a lot of money in these types of scams. So really important to be on the lookout for these scams, that they can come by phone, email, or even through Facebook, to be honest. And we're on that platform today, so you all are familiar with it. You could get a message that looks like it's coming from a friend, but is really a scam. And it's really important to be on the lookout for that. And if anyone asks you to make a payment with a gift card, that's kind of a red flag too. Scammers will not just ask you to wire money, but to go and buy an Amazon gift card and read the numbers off the back. And then they can immediately, capture that cash. And it's pretty easy on their end. So I want to move on. We're going to talk a little bit about neglect. And neglect is a form of abuse that occurs when the caregiver doesn't respond to the older adult's needs. So they're not helping them in the way that they need physically, emotionally, with medications, with medical care. And what also can happen is self-neglect. And this is when the senior or older adult threatens their own health and safety because they're not providing for themselves. That could be food, water, clothing, shelter, personal hygiene care, medication. And actually, most research points to self-neglect as being the most common form of elder abuse. So I have a case example here. There's a gentleman named Gerald. He's 73, and he had a stroke, which left him weak on one side and really impaired his judgment. But Gerald was a very successful professor. So he is a very intelligent man, and he was able to clearly tell the hospital, okay, this is my plan for when I'm at home. So he seemed very capable of taking care of himself. And a neighbor offered to drive him home from the hospital. When he got home, he didn't want to pester the neighbor. He didn't want to ask more of her. So he told her, oh, everything's fine. And, he went into his house and the neighbor went back home. Now, a couple of weeks later, a family, a distant relative was in town and said, oh, they would look Gerald up. And they went to his house and they were really surprised to see that there were food stains on his clothes. The house smelled a bit of urine, and there was mail stacked up everywhere. It wasn't clear if he was paying his bills. And when asked, Gerald said, oh, everything's fine. I have it. And he declined her offers to help him. So in this case, Gerald might feel ashamed to ask for help. He has a history of being independent and professional, and he doesn't really want to rely on the help of others, but clearly he really cannot manage on his own any longer. So this would be an example of self-neglect. So I want to just quickly share some slides here to just kind of review some of this information. And first off, this is just a reiteration of the elder abuse that we went through, the different types of elder abuse: physical, emotional, sexual, abandonment, financial, and then the neglect, which of course includes self-neglect. And just to note that these can occur in a variety of settings, in someone's home or in a family member's home, also in a facility. And the perpetrator might be a family member, someone that you know well, that the person knows well, or it can be a stranger, someone hired as a caregiver, or even someone you don't know at all, like on the phone. Now, there are some signs to look for elder abuse, and went a little too fast. I've listed them here. So that would be looking at someone's mood, kind of how they're feeling, if they seem depressed or withdrawn, looking at if they're isolated from family and friends, and then really what do you see kind of physically? Do they have bruises or burns on their body? Are their glasses broken? Are they always kind of disheveled or dirty? Maybe they seem like they haven't had enough medication. Or are there bed sores? And that can occur on the body when someone stays in the same position for too long. So that could be a sign of neglect, that someone's not attending to their needs. And then recent changes in banking or spending problems, bills and arrears, that can be a sign of elder abuse. Now, people are at various risk for elder abuse, and it has to do with some factors, such as needing help with activities of daily living. So if you need more help, then you're more at risk of getting a bed sore, for instance, because you need to rely on someone to turn you, someone to help you. Also, if you live alone, you might be more at risk for having self-neglect, because there's not someone there to immediately offer to help, and then you might not want to reach out for help. And we're going to talk a little bit more about that later. Or feeling depressed, feeling lonely can lead to some of these types of elder abuse, such as, getting wrapped up in one of those romance calls, really feeling like you made a new friend when they're just out to scam you. So it's important to kind of be aware of those. And Kristen's going to go into that in a bit. So really important here is what to do if, someone is a victim, or you suspect that you are a victim of elder abuse. So in LA County, if you live in the community, meaning you live in a home, an independent house that you rent or own, or an apartment, but not a facility like an assisted living, in the community, you would call the Adult Protective Services. And this is an LA County resource, and you can call them 24/7. You can consult with them on a case like, my neighbor, this has been happening, what should we do? Or you can tell them straight out, this is my experience. Now, I want to say that some people sometimes confuse the operations of Adult Protective Services with how Child Protective Services works. And we commonly know that Child Protective Services has a protocol for removing children from a home where they feel there's abuse. Adult Protective Services doesn't operate in exactly the same way, because oftentimes, as in a case of self-neglect, they might come into the home and partner with the senior or the family and see what options are available. As an adult, people in this system are treated differently because they have, they're not minors, as in Child Protective Services. So I think it's really important to consider calling and getting their feedback. And the social worker often comes out to the home and does a visit and really helps to support the client and their family. Also, you can always call local law enforcement, as I mentioned earlier, if something is acute, it's happening right now, it's very scary, someone is being abused, please call the police. And if there is a fraudulent scam involved, you can call law enforcement or the FBI. It seems silly to some people, like, well, how are they going to find that person off in, another country? But the FBI is trying to track these scammers and sort of address the problem. So you can even go to this tips.fbi.gov, just write in what happened, and they are gathering all that information. So I encourage people to do that to kind of help with the broader problem. Now, if somebody lives in a facility, that would be an assisted living facility or a skilled nursing facility, there's an long-term care ombudsman, and you can call them during the week, during workday hours. And if there's a crisis at one of those facilities, then you can call this state crisis line at 24/7. And so that's really important to address issues that are happening in the facilities. And the ombudsman really partners with the facility. So they should be in there periodically visiting other residents. And if you live in a facility and, tonight you're on the way to dinner, you might notice this number on posters in the hallway. You should, because it's something that should be posted in every facility, and you or your family are certainly welcome to call. Another important thing to note is just to talk about it. So if you are concerned about yourself or someone else, and you're at your next doctor's appointment, or you are, calling a social worker, just tell them what you've been hearing, what you've been seeing or experiencing, so that they can help to provide you with some support in that process. And in the case of especially financial scams like the phone scam, it's really important to tell a family member or a friend, because they can kind of talk it through with you to find out if it's really legitimate, or if it might be a scam. And I will say that typically when something is legitimate, you have time to make a decision. So if, a pharmacy calls you and says, I need your Medicare number, I want to send you your diabetes supplies. If you tell them I got to call back in an hour, they're going to say, okay, call me back and we'll get it set up. So that's really one of the things that's a red flag, is like the pressure. You have to give them the information now. You have to give them the money right now. It's because they don't want you to go talk to someone and realize the mistake. So I think it's really important to just talk it through with someone. So now what we're going to do is I'm going to turn it over to Kristen. She's going to share some of her experiences and talk a little bit about self-care.
Great. Thank you so much, Kathleen, for that information. And I just want to reiterate some of the things that you had talked about in terms of talking about it and the importance of open communication and what that looks like. Especially if, this is a family member that you have noticed that this is happening to. The idea is that we want them to open up. We want our loved ones to be able to talk about it. They feel so shameful for what's happened. And wagging a finger at them is not really going to be the answer to it. So we do have to keep the communication extremely empathetic, very compassionate, understanding this could happen to us, even, at 30, 40, whatever the case may be. These are professionals and they know exactly what they're doing. They know that our older adults have been isolated for an extended period of time. They may be lonely and they play upon their sympathies. It works. And I think as family members, it's important for us to recognize that. And in terms of, feeling kind of silly, maybe reporting it to the FBI, I understand that, but at the same time, I think it leads to something that's better for us in terms of our mental health, and that's empowerment. We know that we've done something about it, right? The FBI may not be able to track down all of these scams and all of these people that are doing these things, but we know that we've done our part. And by talking about it, we know that we've done our part too. Getting it out there, talking to your peers about it is really important too, so that they know and it doesn't happen to them. I can't say enough about that. I know that this has been a personal thing that my family has gone through. So I say that from the bottom of my heart, talk about it, talk about it, talk about it, and be as empathetic and compassionate as you can. And just like Kathleen said, it doesn't have to be done right away. If it looks too good to be true, it usually is. I do want to take some time to shift gears The abuse that Kathleen had talked about, the physical abuse, emotional abuse, abandonment, scams, these are all kinds of abuse that we can really recognize and are somewhat obvious. It's the less obvious forms of abuse that are probably a little bit more insidious and often more dangerous because we don't talk about them, just like what we were saying, and they're not as obvious, right? And those are the self-neglect, abuse issues, and abuse at the hands of our immediate caregivers and family members. And what I say to that is, I think that the best intervention and one of the key interventions is self-care. So I do want to talk about self-care, and this goes for my older adult that may be teetering on self-neglect, and my caregivers that are frustrated and on the teetering of burning out, right? So I don't think anybody wakes up, one day and says, you know what, I'm going to start neglecting myself. I'm not going to take care of my bills. I'm not going to eat right. I'm just going to sit on this couch and develop bed sores. People don't do that, right? And caregivers, loving caregivers, the daughters that are taking care of our loved ones are not, they don't say, you know what, today I am going to speak to my loved one in a less than respectful way. They don't wake up thinking about these things like that. It happens over time, and it is a process. And we need to act before we get to that point, right? Because we are all subject to that. Our bodies are getting older. We're going to need more assistance eventually. And as caregivers, we have multiple pulls on our energy. So we do get frustrated and we do have the potential to burn out. So what do we need to do? How do we manage all this self-care that everybody always talks about, right? And I think it goes back to, this idea of socialization. We've really had to pivot these last 18 months because of the pandemic. Making connection looks different now. Asking for assistance looks really different now. But we have to look at our current connections. We have to continue to engage in them and attempt to make new ones, establish new ones when we can, and place new energy into existing ones. I want to take this time just quickly to talk about our Senior CareLine, which Kathleen, it was her brain trust, and it is a wonderful program that connects one of our volunteers that were just itching to do something during the pandemic with an older adult out in the community that needed to talk to somebody. And you have these two individuals that come together and they talk about, you name it, hobbies, interests, pets, children. They probably gossip, all of those good things, right? All of those good things that we need. And it's been a really successful program. I highly recommend it. We are going to give you more information about that at the end of the presentation. Also, we need to talk about what socialization is and what it's not, and how we can ask for help. I think, again, going back to what Kathleen was saying, so many folks don't want to ask for help because we think that we're being a burden, where we really value our independence, especially here in the United States. Asking for help is really kind of a form of weakness, right? And that's really, it's going to put us in a dangerous position. We have to get real about that. We have to start asking for help. The truth is that the people around us, they want to help. They just don't know how, and they don't know how to approach it sometimes. And we don't know how to ask for it either. We've just got to be honest and be very specific. It doesn't necessarily mean that you ask somebody to come in and clean your home from top to bottom. You can ask for specific tasks. Hey, while you're out getting groceries, do you think you can pick me up some? Today I had a rough day. What do you think about, coming over and taking a walk with me? I could really use some time just to get out in the fresh air. It's those little things that really help us and prevent us from those the ability to start, engaging in some self-neglect, and also creates that connection. And you never know, you might be actually helping somebody when you ask them for help. Everybody has the need to be needed. And when you ask somebody for help, you have the ability to do that. Caregivers, same thing. I'm going to call out and say, please start asking for help. I know that you're frustrated. I know that you have multiple pulls on your energy. Start asking for help. And when you have an older adult that you're worried about, ask them those questions. Ask them questions that are meaningful for them, right? How can I help? What would make this easier for us? I think a lot of times as caregivers, and myself included, we come in like a bulldozer and we say, this is what's going to happen, right? And that isn't going to work. It just doesn't work. We have to ask our loved ones, what does this mean for you? How can I help? How can we work together, right? Okay. Now, we know that there are tenets to self-care. Our doctors tell us about them. Our nurses talk to us about them. We hear about it all the time, every other where, there's all these tenets of self-care. The first one is health. We have to monitor our health. It's really important. I know a lot of folks have had to shift to telehealth, and that's been a big deal. If you're struggling with it, reach out to the office, ask them to help you out. Ask one of your younger neighbor kids, ask your grandkids, help me out. I need to figure out how to do this telehealth thing, right? The pandemic has really forced our older adults to become really savvy patients. They have to know what they're taking, they have to know their disease, and they have to be able to talk about their signs and symptoms. It's a lot, right? Okay. Also, now we know that we're starting to open up. It's time to get back to the preventative health. So what does that mean? We have to go back. We have to get our mammograms. We have to get our colonoscopies. We have to get our teeth cleaned. We've got to get our eyes checked, and we got to get our hearing checked. We've got to do all of those things in order to keep ourselves well. Physical activity, I don't have to tell people we need to engage in some physical activity. I think the misnomer is this, that physical activity looks like I am going to run a marathon tomorrow. No, that's not it, right? We have, in our Powerful Tools class, we have so many caregivers that come in and we ask them, what are you going to do this week for self-care? And they say, you know what, I'm going to start running tomorrow, and I'm going to run 5 days a week, and I'm going to run for 30 minutes every day. And that's really not realistic, right? It doesn't set them up for success. So when I talk about physical activity, I want you to ask yourself, what does this really look like for me in terms of being realistic? How can I set myself up for success? And what makes sense for me at this stage where my body's at? Does that mean that I go to, start this gym membership and start lifting heavy weights? Probably not, right? I'm going to start where I'm at, and I'm going to do something that's fun, and I'll continue to do. We have to do some type of physical activity. Nutrition, right? We've got to eat well. We've got to eat good. We've got to eat for fuel and for energy. We've got to start monitoring, some of the mindless eating that we've maybe started to engage in, myself included, eating for boredom, eating to fill a void. The pandemic, I think they're calling it the pandemic 19 instead of COVID-19. Yeah, we need to start figuring out what we're going to do about eating well. Mental health, it goes back to what we were talking about before. We've got to communicate it. I'm not feeling good. I'm depressed. I've been crying a lot. I don't feel like myself, right? Talk about it. Talk about it with somebody you trust. And know that it is completely normal. We've been through a lot these last 18 months. We've had to make a lot of changes, and we've had to pivot in major ways. You are not alone. And I just want to pitch my Powerful Tools series. This is a wonderful opportunity for folks to come together. It is a Zoom platform. Eventually, we'd like to go back into in-person meetings. We think that that will happen, but this is a great opportunity to talk about self-care and to practice it on a daily basis. We'll give you more information about that towards the end of the presentation. When we talk about mental health and cognition, we also, if we're experiencing some forgetfulness, it's time to start talking to our doctors about that, and perhaps getting a referral to get a cognition test to see where we're at. I think a lot of times people think that we have to engage in therapeutic counseling, but that's not always the case, right? There's other modalities. We can go to our church, we can go to our clergy. A lot of times there's Bible study, and there are support groups, and there are peer groups that we can engage in that are just as strong and just as valuable. I can't say enough. I mean, Kathleen and I are social workers and in the mental health field. So we really, we do place a heavy emphasis on this. I talk to my caregivers a lot, and my clients, about the importance of gratitude, journaling, engaging in the outdoors, singing if you're a singer, dancing if you're a dancer. Just to touch on a quick story about a journal. I did have a family member that once, she would call her dad on a daily basis, and he would basically tell her everything that he had journaled throughout the day. It was a really great way that they kept connected and kept him cognitively engaged, and her knowing what was happening with him. Sleep, get it. Know when it's too much or too little. And if you're having difficulties, get a referral for a specialist. I just recently had to do that myself, and they said that once things opened up, they had over 100 referrals. This is a real thing. Their sleep is being affected by what's happened to us for the last 18 months. Lastly, and this will be the last thing that I talk about, second to last thing, I'm sorry, is our spiritual health. We need to find a way to replenish our soul. And what does that look like? Is that going to church? Is that engaging in Bible study? Going on nature walks? I know that the Arboretum, for those of us that are in the community, in the Pasadena area, Arcadia, they have regular opportunities to engage in a sound bath and also go forest bathing. And if you don't know what that is, look it up. It's a great thing. Lastly, this will be the last thing that I say, is we have to find a way to nurture creativity. And that is kind of an all-encompassing way of finding that thing that brings us joy, nurtures our creativity, and keeps us engaged. During these last 18 months, I am not a good crocheter, but I've started crocheting. And it has been a wonderful way to engage my creativity and keep me sane. Thank you so much for letting me share all of these ideas with you today. And I really look forward to hearing from you either through the Senior CareLine and or our Powerful Tools series. Thank you so much.
Thank you, Kristen. I appreciate that. I like how you explained all these different facets of self-care, because people talk about it all the time. What do you do for yourself? And sometimes it's hard to come up with ideas. But I think those are great ideas. It gives me some encouragement myself to get back into yoga, or I have this giant cross stitch project that I'm working on. So that's really fun. So thank you. And I think that it is a nice, kind of part of this presentation is sort of elder abuse is a challenging topic, and it's a very serious topic. But if there are things that we feel we can do to help support our neighbors, our community with our knowledge about the topic, and also to support ourselves with caring for ourselves as we, age and as we engage with older adults, then we feel we have some power. We're empowered in this process. We can help to change our community and make things better. So what I want to do is just share my screen again here to kind of go over some of these resources. I'm sure that Home Instead could provide you with any of this if you happen to not, get to write it down. But this is what we went over last time. Again, if you need to report elder abuse or if you're concerned about it in the community or in a facility. And then I just wanted to go over a few resources that we have here. So if you know someone who's been a victim, the reporting is sort of the first step. And then after that, there's a lot of options for support. So 2 services in our community I want to highlight are BetZedek. BetZedek is a legal services. They provide a ton of pro bono legal services, but of particular interest to this topic might be that they can help older adults get restraining orders when necessary. So that might be in a situation where a family member or a friend is really detrimental to that older adult's life, and they need to have that protective restraining order. So if you have questions about that, you can call BetZedek. And Foothill Family has a wonderful program to support people who have been victims of elder abuse, and a social worker talks with them, works on them kind of recovering from that experience because it can be very traumatic. So that's a great resource as well. Regarding the self-care that we talked about, so Powerful Tools for Caregivers is an evidence-based class that we teach twice a year. It's 6 weeks long and it meets on Friday mornings. It'll be starting in July. I think July 9th is the first Friday of this new series. So Friday mornings in July around 10 o'clock. And like Kristen said, it's going to be via Zoom. And we have a couple of facilitators. Kristen and I have done it a couple of times. We have another colleague, Carla, who helps with it. And it's really a great opportunity to get to meet other family caregivers, other people who are caring for loved ones, and to talk about the challenges of that and how to find yourself again, how to take care of yourself and nurture yourself in that process. So please call Kristen, and this is her direct line, and you can check in with her and she can help you to enroll in that. And then if you're a senior or someone we don't actually have a age restriction on it. So anyone, any adult who would like to chat with someone on the phone, feels isolated, just wants to make a new friend. The Senior CareLine is just that. I have a whole list of dedicated volunteers who are interested in talking on the phone. And I try to match you up, if you both like knitting or if you both like woodworking, one gentleman liked. And so this is my direct line here. You can call me and then I will take down some basic information and match you to a volunteer. And then you chat once a week, twice a week. Some of my pairs have been talking for the whole year. They've been talking since I assigned them last summer. So it's fun. It's supposed to be really light and enjoyable. So if you're interested in that program, please give us a call. And then finally, as we mentioned, the Resource Center. So if you are interested in anything related to senior care, housing, you name it, our resource specialists have been working for decades in this field and know a lot about what's going on in our community. And so you can call them anytime at that number and pick their brains, ask any questions. And they're familiar with all of this. So if there's something you forgot, just remember, I was on the Home Instead Facebook Live event with Kathleen and Kristen, and I wanted to know more about it. And they can definitely, redirect you and get you some information. So what we're going to do now is I will leave these up, but we were going to take some questions if anybody has any questions. So I'm going to try to figure out how I see those. So we have a social media manager who is helping us through. So he's put some questions in. So I'm going to just take a look here.
I've got the first question for us, Kathleen.
Oh, great.
This one is, what do you do if the elderly person is threatening me, the family caregiver, of not eating or taking medication? I can take this one.
Yeah, sure.
It sounds like the individual that is being cared for is threatening the caregiver of not taking care of themselves, of not eating or taking medication, if I understand the question correctly. And I I think what I would say is that it's an opportunity. It's an opportunity to check in with yourself as a family caregiver to find out why they are making these statements. Is it true? Do you need to take better care of yourself? Are you not taking medication, or are you not eating? I think it's an opportunity to check in with yourself. But if I misunderstood that question, please elaborate.
And I think it's a good point to like the way our Powerful Tools program works. So if you are a caregiver, you're dealing with a lot of things, at once. And so the person you're caring for, it can be very challenging, can be very tricky. And Kristen and Carla and I, we can provide also some additional consultation through that program. So you come to the class, you learn about self-care, and then you're like, oh, let's talk things through a little bit more. And then when we learn a little more, we can give you some referrals. I mean, sometimes in situations, there are other resources in the community that we also refer to. Alzheimer's Los Angeles, there's a family caregiver resource center. We have various programs that provide additional support. So I think that this really gets at like that trickiness of caregiving in general, and that the situations can get sticky.
Absolutely. Okay, the next question is, what do you do if you have a family member living in your house that is supposed to care for my grandmother, but they will not move out?
So I can take this. This is a similar situation to the example that I gave with Vivian, who had the son living in the house, or some situations that I heard about through Betzedic. And so it's sort of like a family member comes into the house and is taking advantage more than they are supporting the senior, it sounds like. And that's something that, as a family, you can try to address. You can try to talk to that person about what your expectations are, what they're capable of providing, and not, and sort of see if you can work it out as a family. And if not, then some type of mediation might be helpful. And so a service like, getting in touch with a social worker who does some kind of mediation, or a geriatric care manager type person, or Betzedic, if it's gotten to the point where this person is, downright abusive and should not be living in the house, and there are legal ways of essentially evicting them and, putting in something that's more protective for the grandmother.
Excellent. Next question is, how do you confront someone of elder abuse? Or better yet, how do you gather evidence of elder abuse? Or is it purely word of mouth?
I was thinking that what you might be getting at with this is like just, kind of your word against my word, like getting that evidence. In social work, when we report regarding elder abuse to the numbers that I listed, we don't need evidence. Essentially, if we suspect it, we report it. Because it's not our responsibility to look into it. And I would say that is a hefty weight also on you as a community member, as an individual, like to figure it out, to prove it. I think that if there's any suspicion of it, then calling the Adult Protective Services is helpful, because then that's their role to really assess it and see what's going on. And then they can kind of take it from there.
I would ditto that. I would definitely ditto that.
Yeah, it can get tricky when you're trying to figure everything out. I can read this next one. It is, what do you do if you know the elderly person you care for is a danger to themselves, but they insist on denying more support in their day-to-day? I am the granddaughter. Who would I contact?
Okay, I can take this one. I think, okay, so if I'm understanding the question, it is the elderly person is a danger to themselves. I would say if you feel that it's a life-threatening event or a life-threatening emergency that you need to call 911, the police and the sheriff, you definitely need to do that. But they insist on denying more support in their day-to-day. and this is a granddaughter. Okay, who would I contact? Again, I would say that you should probably call Adult Protective Services, the police, and make sure that the individual is not going to harm themselves to the point of, running that risk. You don't want to get that far. So make sure that you call the police, get that support. I don't know if there's anyone that you would call that could come in if somebody was a danger to themselves, other than the police and APS.
Yeah, I think that's what I'm thinking of too, because, there is ability to put a hold on someone. If they're a danger to themselves, we have a protocol in Los Angeles County that the police can help walk through. And that's really like if you suspect that someone might be at danger of committing suicide, or, they're really unable to take care of themselves and they are what we call gravely disabled. And then they can be taken to a psych hospital on a hold, even if they deny it. So the police have a team that will assess if that's appropriate. But if this is more of a case of self-neglect and they just keep denying, they don't want anything, I think APS would help with that, because then that's a support. That's a social worker who's going to come in and sort of look at the situation and see what more might be needed, and then refer to services that can provide that support.
Right, absolutely. Well, it looks like we are currently out of questions. So why don't we go ahead and say goodbye?
Yeah, thank you so much, Kristen. It was really interesting to hear from you today. And I hope that everyone learned something from the presentation, gathered some information. You have our numbers that I had posted up on the screen. And if you need anything, please reach out to our resource center, and we're happy to support you. And we thank you all. We wish you all very safe and happy rest of your day. So thank you.
Thank you.
Bye-bye.